What is your name, please? James Jones. Where do you live, doctor? 309 North Elm Street, Wilmette, Illinois. Your office or business or profession? Physician and surgeon. How long? Since 1938. Have you specialized in any particular branch of your profession? Yes, I have specialized for the past 8 years in fractures. Are you called in as a consultant in fracture cases, doctor? Occasionally, yes. I will ask you whether or not you were called in as a consultant in the case of little Dennis Malone. Yes, I was. When, doctor, was the first time you saw the boy? November 1st, 1953. You made an examination together with Dr. Johnson, doctor, did you? Yes, sir. Will you tell the court and jury what your examination consisted of and what, if anything, you found? At the time I made the examination on November 1st, I found a young child approximately 3 years of age who was lying on a hospital cot. His right leg was obviously deformed, inasmuch as there was an anterior bowing of the upper leg just above the knee. In addition to that, there was an extensive laceration, as I recall, about 8 inches in length. Where was this laceration, doctor, please? It was on the outside or the lateral aspect of the leg, extending from just above the knee down along the lateral aspect of the leg back across the back of the knee, extending through the subcutaneous fascia, which is the covering just beneath the skin and the fat and the muscle tissue, with marked destruction of skin, fascia, and muscle. By marked destruction, doctor, you mean what? The tissues were bruised and devitalized. They were no longer living. Was there anything about this area of the synovial membrane? The area of the synovial membrane surrounding the knee joint was also open. Was it exposed, doctor, to the naked eye? Yes, it was. What, doctor, if anything, was done for him? That wound was cleaned and the devitalized tissue, muscle, fascia, and skin were excised or cut away, and the muscle, the tissues were brought together with sutures, as was the fascia and the skin. Then there was a fracture of the leg as shown by the x-ray. This was manipulated and a plaster of Paris cast was put on following dressings over the wound itself. Is that the usual and customary type of treatment, doctor, in your opinion, in such cases? It is. Doctor, in your specialty of fractures, do you have occasion to read x-ray plates? Yes, I do. Are you able to read them? Yes. I wonder if you would give us, doctor, your special experience and skill in reading these exhibits, which are numbers 8, 10, and 11, and pointing out any pathology you may find. You may put that light on if that will help you. This is exhibit number 7 on the shadow box. This x-ray plate shows what we call anterior, posterior, and lateral views of the leg around the region of the knee joint. If you raise the film up, this also includes the entire length of the lower leg and the bones of the ankle. The ankle and the bones of the lower leg are normal, but by an examination of the bone making up the upper part of the leg, we see a definite deformity. We see a bright or dark line through here, which indicates there is an interruption in the continuity of the bone. Instead of being the perfect gray as it is here and here in the normal bone, we see the brightened and darkened and straightened area. We see an interruption of the continuity of a fracture. Doctor, is this also seen on the lateral? Yes, where we see that interruption of the continuity. We also note one additional fact on the lateral view, that is, that this fracture extends down into the bone. There is an anterior bowing, that is, the bone is out of shape. Instead of being straight as it should be, it is bowed, and there is an overriding of the distal or lower fragment up onto the upper fragment, and it can be measured approximately. It is seen here to be a distance of about a ½ inch. By overriding, doctor, you mean the continuity of the bone? You mean one is out of line with the other? That is right. This is exhibit 8, is it, doctor? Yes. Here again we see an x-ray picture of what appears to be on the shadow box and is the bones around the knee joint, with the exception in this picture. The bones are encased in a plaster of Paris cast, which gives rise to these unusual shadows around here. But doctor, however, there is still some little bowing toward the front, is there? Yes, rather than being straight as it should be. This is Exhibit 10 on the shadow box, which shows approximately the same thing around the knee joint, showing the overlapping of the bone here, showing the bowing. Instead of being straight, it is curved, showing here a bright line indicating a fracture just above the articulation of the knee joint. Doctor, you have told us by the reading of the x-ray plates and upon examination, you have told us what you did for him. Tell us now what was done after your first examination. Did you take him, doctor, to the operating room at any time? Yes, surely took him right up to the operating room, right from the emergency room. What did you do there, doctor? Cleaned the leg up, as I said originally, debrided or cut away the dead tissue, that is, the dead skin, dead fascia, muscle, and approximated the fascia, and approximated the skin, and then manipulated this fragment and tried to pull it down and tried to correct that overlapping or overriding, and then dressed the wound and put on a posterior molded splint or plaster of Paris cast.